Hello, this is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today what we want to talk about is scoliosis. Scoliosis, as everybody probably knows out there, even little kids, scoliosis is curvature of the spine. Now there can be a number of different ways that people have scoliosis. There's rotatory scoliosis, there's what they call levoscoliosis, which is to the left. There's dextroscoliosis to the right. They can have scoliosis only in the lumbar spine. They can have scoliosis only in the thoracic spine. They can have scoliosis in the thoracic spine and the lumbar spine. But when it comes down to it, what is scoliosis? Scoliosis is imbalance in the neuromuscular system. And there can be a number of different reasons that people suffer with scoliosis. There's absolutely a genetic component. Girls suffer 2 to 1 to boys. There are other neurodegenerative conditions that people can have that can be at the seat of why someone has scoliosis. But then there's another really big category of people they call idiopathic scoliosis. And what idiopathic means is they have no idea where it's coming from. In many cases that we've seen over the last 18 years in our office who are dealing with idiopathic scoliosis improve markedly when they have their upper cervical spine corrected. So in our office, we are experts at determining whether A, you have one of the upper neck vertebrae that's structurally out of its normal biomechanical range of motion and it's impacting the central nervous system aberrantly. And not only can this be at the root of many people who suffer with scoliosis, it can also be at the root of a whole host of other chronic health conditions that people suffer with. So I don't know, over the last 18 years, we've probably had at least 200 cases of scoliosis in the office. In fact, my 5th patient, who's still a patient today in practice, had severe scoliosis. She is not a completely straight spine today, but it's probably improved 70%. So our goal in the office, whether someone comes in with scoliosis or they come in with fibromyalgia or post-concussion syndrome, our goal is to find out, do you have something in the upper cervical spine that's misaligned? Is it impacting the central nervous system? And if it is, let's get it corrected so the body can work the way that it was intended to work. Now, in the case of scoliosis, idiopathic scoliosis, these types of cases quite often are caused by brainstem interference. So out of the floor of the head, you have the brain in the head, and then out of the floor of the skull there's a hole called the foramen magnum. That's right where the spinal cord comes out of the base of the skull. And the first part of the spinal cord is called the brain stem. And the brain stem is the seat of control for about 40 different things, but one of the things it controls is postural muscle tone. So in these cases of scoliosis, what's happening is the muscles through the spine, they're completely imbalanced, and the imbalance is pulling the body structurally into a scoliotic pattern, right? And what we find with a lot of these cases, if we can find out exactly how that top vertebra is misaligned out of its normal position and very precisely correct it, once it's back in its normal range of motion, the pressure's off the cord, what does the body do? It naturally starts to come back into balance. And one of the things that naturally comes back into balance, because this area controls postural muscle tone, once you correct the pressure on it, the body slowly will start to right itself. And so the sooner this upper neck area is corrected when someone has scoliosis, the easier it is to correct these people. And a lot of these kids, they all get screened in school for scoliosis. And if there's no underlying neurodegenerative condition or nothing genetic going on and your child has scoliosis, it would be a really good idea to get to someone who does this upper cervical work to see if this upper cervical spine is involved in the scoliosis of your child or your friend who's an adult. So in our office, we offer a free consultation. We have 2 offices in the Los Angeles area. One's in Carson, and that phone number is 310-324-6172. And then our second office is up in Los Angeles, and that phone number is 213-399-7772. If you're outside the Los Angeles area, you've come across this video on YouTube and it's piqued your interest, there are upper cervical docs throughout the country. You can give our office a call and we'd be happy to find you someone that's in your location that can help. So hope this information was educational and has piqued some of your interest. There are solutions in the natural healing paradigm that are outside of mainstream medicine that oftentimes prove beneficial for these types of cases. So thanks for listening, and we'll see y'all soon.